Hi guys, I have just a few updates and a recap of our staff meeting that happened about a month ago. Sorry I'm late. So the first thing I wanted to touch base on was our new discharge process that we talked about in staff meeting. This includes just a few handouts that we were going to give to mom and then one for baby. Our newborn teaching for baby has not come back from the print center yet. And so that's what we're waiting on before we officially roll this out. And I think I'll also need Catherine and maybe Tabitha to put a video together to show you guys how to use the smart phrases that Catherine has made to show what documents we've given to the patient for education on discharge. I hope that all made sense. Anyway, ask me if you have questions. For our labor nurses, when you're titrating your oxytocin above 20, we used to have a whole different order for this, but it's all been rolled into the same order now. And they've been updated, they've been fixed. So both of our oxytocin orders say 1 to 30, but you still do need to get a provider order, an approval to do titrating above 20, and you always need an IUPC in place. Deborah has updated our surrogacy and adoption checklists, and there are copies of them in the folders at the second floor nurses station. I'll have to check and see if they're at the third floor nurses station too. So you guys can grab those on admission, just keep them on the chart. And there's a section for techs and a section for nurses, so you guys know what you're responsible for, just making sure that you're doing everything appropriately for each type of patient. Bedside shift report is everyone's favorite, and we should really be doing this every patient, every shift. Our third floor postpartum nurses are rocking it. You guys do a really good job making sure you're going and giving report or at least handoff at the bedside. This is me begging, pleading, telling, commanding all of my labor nurses too. Please go do bedside handoff. And here are the 5 things that I want you guys to do while you're in there. I want you to check lines and drains together. Fill out the whiteboard if you're the oncoming nurse. Make sure that your name is up there. Change the date if you need to. And then next, pain medications and the plan of care for the day. Include the patient in the plan of care and in your handoff. This is something that they ask for on our surveys. And it's interesting, we've seen a couple responses lately where the patients are really wanting more involvement and more interaction during that shift report. And they said they wish the nurses would have given a better report. Anyway, so that's a really important one, to make sure that you're including the patient and their spouse in that plan of care. The 4th thing is to please check for any safety or environment issues. Remove the clutter, remove any safety issue that you are seeing. And then the last thing, make sure that your medication scanner is docked on the charger correctly so that it's linking up to the computer. I've heard there have been a lot of problems with the scanners not working, and so we're gonna try this and see if just making sure that they're docked correctly helps them communicate with the computer and stay charged. So those are your 5 things. Check lines and drains, fill out the whiteboard, including the patient in the plan of care, check the safety and environment, and then making sure your scanner is docked. Those are my top 5. My next item of business is lunch punches. Everyone's favorite also. Oh, we're not thriving in this category, and so I am also begging, pleading, asking, requesting, commanding you guys to please take a lunch. I know that there's been time for the last couple weeks while it's been a little, you know the word, nice. It's been nice on the unit. It hasn't been crazy. So punch out for lunch. If you forget to punch, but you still had time for lunch, please write it in the book, and I will go in and put a lunch punch in for you. We can't change any of your punches without your permission, and it does not automatically take a lunch out for you. So either punch or write in the exception book if you have forgotten to punch for lunch. Okay, a few more FYIs and reminders. Our instruments are no longer stocked in the bassinets for our vaginal delivery tables, they have to be in a place where the temperature and humidity is monitored. And so they are only going to be stocked in the clean supply room. If you need to set up a table, you can go grab a set of instruments from there. Sutures should be stocked behind the card that they're labeled for. I have a couple new products, same kind of products, just different names. So our Dermabond is now Exofin, and our Arista powder is now Perclot. Same concept, just different names. Labor nurses on admission, will you please make sure you are updating the patient's preferred pharmacy? If there are 2 or more pharmacies in there, take out the ones that they don't go to, as this kind of creates problems when the provider's putting in orders for discharge. It can send medications to 2 different pharmacies. It can send them to no pharmacy. So please make sure just the one pharmacy that the patient wants to go to is in Epic. Keep an eye on your HealthStream due dates. We have a few mandatory ones that are coming up at the end of, well, I think we have one at the end of September and then another one at the end of November. Our passports are all due in November. Yeah, so just please keep an eye on those and stay up to date as you can. If you have an N95 test coming due, see Melissa or see Cami or another CNC, get that passed off. Well, we've moved a few medications around in the Pyxis. So our Tylenol and Labetalol tablets look very similar. They're both white and round, and they're right next to each other in the 3rd floor Pyxis. So we have moved those apart. Just make sure, since we have changed where they're located, that you guys are paying attention to what you're grabbing. The other medications that we've moved are the immunizations. They are now on the bottom shelf in the fridge. And then our hemorrhage meds are on the shelf that are right above the oxytocin in the 2nd floor med fridge. A couple more things. We have a new policy for laboring patients in the tubs, thanks to our fun Joint Commission friends. So familiarize yourself with that. I'll post a picture of it on the GroupMe so you guys can read through it. It's very generalized and very vague. So things that we're already doing just in a policy written format. And then the last thing is our blood bands, our green bands, are now going to be stocked in the cupboards in the patient rooms so that the nurse is taking accountability for making sure that they have the right blood band sticker on the type and screen for their patient. And you're doing that with 2 patient identifiers, scanning everything at the bedside. Please, please, please do this. And thank you guys for all being amazing. Our patient satisfaction scores remain to be great. We get patient comments back every week, and it's so fun to read how much these patients just adore you guys and are so, so grateful for the compassionate care that you provide. So I'll print out some more of those patient comments and hang them in the break rooms because you guys are doing a phenomenal job. Yep, that's all I've got.